In California alone, nearly 2,000 people have died from an opioid overdose in 2016. And in fact, according to the California Health Foundation, there are enough opioids prescribed to every man, woman, and child to be medicated 24 hours a day for an entire month. So it goes to show the brevity and the importance of addressing this issue at hand.
I'm here today representing the thousands of victims of opioid abuse in California and the families that have suffered throughout the consequences of this terrible epidemic that's far-reaching. Years ago, I'm also the father of two children, my 10-year-old son Troy and my 7-year-old daughter, who were run over and killed by a doctor shopper of narcotics who was abusing and doctor shopping to numerous doctors getting medication, and drove off the road and ran them over when we were, as a family, out for a walk. Years ago, I had the idea for an electronic cures program in California, and I took that to Attorney General Jerry Brown. He appointed me to oversee the development of the electronic cures program project years ago, which was developed and is working today to cut down on doctor shopping. Subsequently, I co-authored a bill to fund the cures program for the state of California, and then more recently co-authored a bill that would require doctors to check the electronic database before they prescribe opioids to a patient so they know if they're doctor shopping and what their history is. So I'm very proud to be here because when I started out after the deaths of my two children, there were 3 million prescriptions written for opioids in California. Last year, there were over 50 million prescriptions written in California. So the alliance of these great people, lawmakers today, represents the seriousness of how we can attack this problem on multiple fronts. There's no one thing that's going to cut down on this, but it needs all of this type of legislation to attack it from multiple angles.
Much of the conversation we just previously heard was with respect to that of the healthcare provider, but it's also about empowering the tools for law enforcement. So when these prescription pads go missing on the black market, it's important and imperative that we are able to track some of these things so that the law enforcement can say, where did this originate from? And that's one of the pieces of legislation that we have with prescription pads and serial numbers to be able to track that. We also want to prevent doctor shopping, and so pharmacies currently have up to 7 days to upload this information into the statewide database, whereas we have an opportunity in real time within 24 hours to make sure that we are uploading that information so we know prior to prescribing this medication and empowering providers with those tools.